ExamMed is a universal healthcare platform that we created to really empower all stakeholders in the healthcare industry, from adding value to patients by being able to see their own trusted providers and practices in a remote environment, to providers themselves by being able to extend their capacity, and then to health systems in urban areas, especially more so in inner town, rural type areas, to be able to extend their capacity, increase their catchment area, and provide better care and quality of outcomes. Increasing capacity without increasing hours, what does that mean? If I'm a rural doctor and I have a patient that lives 40 miles away on a farm somewhere and needs to come in for their diabetes or hypertension and is elderly or high risk, I don't need to have that person take time off from work or come, or have someone take time off from work, bring them to my office for them to sit, wait to be seen. Many of those chronic care conditions and other types of monitorships and visits and encounters can now be done remotely. So that's kind of the first part of it. The other part of it is providers really being able to influence the impact of what can be done using telemedicine, meaning from an acute condition to a larger condition or a monitorship type of a condition. Those can all be done now leveraging technology. So it saves the provider in the sense that they can increase their revenue, increase their workflow a little bit differently in their practice. And it really has a lot of value to the patient, where they don't have to now journey in almost, as it seems like, to come to see your provider. And not to mention, you can get care immediately and from different sources. So the other value, kind of last value point, is you have the ability now to really increase your catchment area to a much broader level of healthcare focus. So if I'm in Macon and I need to see a neurologist, well, I can see somebody at Emory very easily who has access to my information, my charts, my x-rays, and can be able to diagnose or tell me something that I need to do for treatment. And so if the vision on a macro basis is population health management and predictive trending on outcomes and the likelihood of better outcomes, how do you measure that? How do you affect it? And you affect it on the most micro level, being in a rural area, using a utility like telemedicine or sort of others, because now you're empowering individuals to have the ability to really access information, and then collectively use that to drive better behaviors. And as it relates to poverty overall, if you can make someone healthy, you've in fact made them exponentially more employable, because the fact that they're healthy means that they're going to be able to go sustain a certain type of a job, or go and get training for a certain type of a job, become healthier, become more employable, and through that employability will ultimately be able to sort of create some strong impact and get out of the poverty situation that they may be in.